Good morning and good evening. Here's broadcast from SUMERNET Secretariat, Bangkok. So today we have the very first formal public seminar. So our moderator is Sushmita, so we will give her the floor. But before that, we are glad to have you here. And thank you so much for joining us. We'll be happy to see everyone turn on your camera for just the first session. Thank you.
Thank you, Unchuli, and a very good morning to everybody. I hope we can take this forward. It's 10 a.m. So a very good morning, and just to give you a quick brief on the SUMERNET public seminar that we are talking about here. It is the SUMERNET is basically a sustainable Mekong research network, which is in its 4th phase. It's been around for about 18 years now. And currently in this current phase, we are organizing multi-country collaborative research work with almost 190 researchers, which also include a lot of young researchers. And as part of that work, this is the first public seminar that we are holding, which will focus on some of the findings of a rapid response study that was done, which was a multi-country study between Thailand, Vietnam, Laos, Cambodia, and Myanmar. So I will pass to Dr. Erin Zing for his opening remarks, and then on to Dr. Chantana.
Okay, thank you, Sushmita. And good morning to everyone. I hope you can hear me okay. First, I'd like to say thank you to SUMERNET and the Voices team for this opportunity to give some brief words of welcome to this public seminar on listening to voices on the margins, lessons from the COVID-19 crisis for improving access to clean water for drinking and hygiene in the Mekong region. Already in April 2020, just as the global spread of COVID-19 was becoming more visible and as countries were closing their borders one after another, and airplanes were disappearing from the sky, and when people were really beginning to start to practice social distancing in earnest, SUMERNET foresaw that the COVID crisis was going to have dire implications, especially for people living in poverty and other marginalized groups. And in response, SUMERNET organized an open call for proposals for regional research and research policy engagements to better understand how the pandemic was exacerbating unequal access to water in the Mekong region. On behalf of the Embassy of Sweden and CETA, I would like to thank the Voices team for all of their hard work during these past years, and also to their partners like the Association for Sustainable Development, the Department of Water Supply of Laos, and the Ba 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 Hospital in Vietnam, for their help and work to address water inequalities and insecurities in an informed and inclusive manner. And I would also like to welcome and thank all of our distinguished participants today for their participation and their engagement. And I'm very much looking forward to learning from the presentations and discussions today. So thank you very much, and I very much look forward to today's event. Now pass it back to you, Sushmita.
You're on mute, Sushmita.
Maybe while Sushmita is fixing her audio, I can just say one more thing, and that is that I think that what SUMERNET has achieved by supporting this research is really a demonstration of the sort of flexibility and the adaptiveness of SUMERNET and all of its researchers. And really looking forward to hearing not only about the findings from the work today, but also your reflections on what it means to do research during the pandemic, and when we have this social distancing, and how can one do regional and multi-country research together when one can't meet each other in person, and many times when it's difficult to actually meet your research, the stakeholders, the respondents in person. So I think that this is a very exciting seminar.
Thank you for chipping in, Dr. Erin. And sorry for that little glitch that happened, technological glitches. We are 2 years into this pandemic and we're still figuring certain things out. But nonetheless, so here, Dr. Chantana, you can go ahead and give your opening remarks.
Thank you. Good morning, Dr. Erin Singh, Dr. Niall O'Connor, Dr. Chianit, our research partners, research mentors and advisors, the panelists, friends and all participants. On behalf of SUMERNET Steering Committee, I would like to welcome you to the SUMERNET Public Seminar Series, the first one of this year. SUMERNET, or Sustainable Mekong Research Network, has a mission to improve the policies and practices in reducing water insecurity by conducting collaborative research, engaging in policy process, and promoting scientifically sound research and innovative, while considering gender and social equality, human rights, conflict sensitivity, environmental integrity, and poverty reduction in the Mekong region. This is to hoping for reduced water insecurity for all, in particular poor, marginalized, and socially vulnerable men and women in the Mekong region. The Voices is one among other projects in it is also our responsibility to share the research results, not only with our core knowledge producers in the target areas, but to a wider public and policy community. The Voices project, which is the main topic of the series today, should represent a kind of frontier research in water insecurity. It captures a point in time of uncertainty due to the unprecedented phenomenon of the pandemic, with an innovative methodology to review the voices at the margins. I'm excited to hear what has been discovered and reflections on the projects and the lessons learned during the difficult times of the pandemic. And I would like to invite you to dive into the panelist presentations and engage in the discussion. The steering committee would like to thank our research partners, mentors, and the panelists for putting much effort in times of difficulties for the good research. We'd like to also express our gratitude to SIDA, the Embassy of Sweden, the Secretariat by SEI for the generous continuing support and guidance. Without such collaboration that supports our research network, and the public seminar wouldn't be possible. Thank you very much for joining us today, and please enjoy our public seminar, and hope you will follow our series in the near future too. Thank you.
Thank you, Dr. Chantana, for your kind words. Can we all now switch on our cameras, and I'll request Unchuli to do the next, which is she wanted to take a quick picture of all of us online joining this program.
Thank you, Sushmita. So we would like to request everyone online to just smile and turn on your camera for us few seconds. So we have at least 2 windows here. So we ask you just keep your smile still. I will count on 3. Agos and our team will also help capture, right? Okay. There are some of the team is not open the cameras, but if you can, I will count on 3 for the first batch. So the first batch, smile please. 3, 2, 1. Okay, and another batch. 3, 2, 1. Thank you. Thank you very much. So back to you on the floor, Sushi.
Thank you for taking that time out and getting the picture in place. So moving on and to the main session of the seminar, which is on the research project findings. We have the entire research team led by Dr. Luis Lebel, and he would be giving the first round of introductions on what the research project was, what were the motivations around it, what objectives were being fulfilled through this research, and what the key findings, broad key findings have been. So welcome on board, Dr. Luis.
Thank you, Sanchita. I'm going to share my screen. That's okay. Can you see my screen? Is that fine? Okay, and if I start to, if I'm not loud enough, please, somebody give me a hand signal to hear. So
Yeah, it's great.
okay, so we'll get started. So the Voices Project sought lessons from the COVID-19 pandemic for improving access to clean water for drinking, for washing hands, and for other household uses in vulnerable communities. The Voices Project gathered information on the experiences and views from more than 1,500 individuals in 15 communities and across 5 countries in the Mekong region. These vulnerable communities included ethnic minority villages. They included migrant worker camps, informal urban settlements, and rural villages. The key informant interviews were conducted with 50 people, mostly from government, but not exclusively so. In the first few months of the COVID-19 pandemic, it became apparent that access to clean water was going to be an important issue in vulnerable communities. This was a lot of previous work done by WASH researchers that already told us this was going to be important. It was less clear, however, what influence the outbreak might have had on water insecurities. When we know we have the outbreak, did the country start being proactive in supplying water to villages and communities? So actually improve water, reduce water insecurities, or did they wait and do nothing? So that was what our research was looking at. The rest is our analytical framework on here shows that we were willing to consider a number of indirect and direct pathways between the COVID-19 outbreaks and water insecurities. The rest of this seminar is organized around the 3 research questions, and I'll take them one at a time. How did the COVID-19 outbreak affect household water insecurities in vulnerable communities? To answer this question, we had to define some water insecurity measures. And we did this by combining responses to survey questions. The hand washing water insecure outcome, for example, was related to 8 questions, some about water quality, some about volume, some about regularity of supply, and some even about conflicts over water in the household. So these were combined to define, there was measures also made for drinking water and mask washing water. So these are important technical details which you can find in the paper and the supplementary materials. What we found was that the COVID-19 resulted in changes in practices, some of which would have significant impacts on household water insecurity. So that means they were big enough to impact water use inside the household. For example, if a respondent washed their hands more thoroughly as a result of COVID-19 outbreak, that's what they said they did, then they're 1.8 times more likely to be water insecure with respect to washing hands, not have enough all the time. If they, for drinking water, if they drank more from unsafe sources, from untreated from rivers, etc., they're much more likely to be water insecure related to drinking water. In other words, going without water or drinking very bad water, the water they knew was bad. For masks, it was similar to the washing with hands. But of course, it's not only whether their practices change. Other things also could influence whether or not the house was water insecure, whether the person was water insecure. For example, if you have convenient access to water points in the home, you're less likely to be water insecure. If your house does not have you have to carry water to your house. It doesn't have water, they wash at the tap or outside or just in front of your house or right next inside the house, then you're more likely to be hand washing or drinking water insecure. So the micro infrastructure in a house also matters, and it matters in a kind of a logical way. Our second question was, how did household water insecurities impact the adoption of good practices? So everyone's promoting that you've got to wash your hands often, you've got to clean your mask frequently, etc. But were some households in trouble because they didn't have enough water? So we were looking at the sort of the two directions. So again, we had to define some measures for good practices. And I'll just give, for example, good hand washing practices we measured by questions about how often you wash your hands each day, how much time you spend washing it each time, and what situations triggered hand washing, when you visit old people or after seeing sick people, or before eating, or after going to the toilet, and questions like that. Again, the responses here were a bit more complicated. Household water insecurities made it more difficult to have good practices in two cases. So if you had a high hand washing water insecurity was high score, so you had a lot of problems with insufficient water, then you were less likely to do good practices in washing your hands. So in other words, you're more at risk of COVID-19 infection, 0.7 times likely. If you were drinking water insecure, had a high score, you were also less likely to have good practices related to drinking water. I mean, to boil it and treat it, etc. For washing masks, there was no effect. From our in-depth interviews, you can see I put some quotes here, but they realized that it's not only about water, it's also about water and sanitation. And these two things are linked. Our results show they're linked for some of the practices, but not for all. In terms of water systems, there's also some strong associations. If you're more likely to follow good hand washing practices if it was easy to do so. There was easy places to wash your hands in front of your house, inside your house, next to the toilet, as opposed to some that had to go and get water somewhere else. If you have to go and get water somewhere else and bring it to the house, then obviously it's less likely you wash your clothes as often as you would wash your mask as often as you would. Now, there were a lot of interesting findings related to gender, but I'm only going to just pick up two. First of all, women were more likely than men to adopt good hand washing practices. But regardless of whether it was a man or a woman responding, households in which women had a greater role in securing water supplies, so that's a household where the women did most of the decisions around water supply, were more likely to wash their hands too, regardless of whether it was a man or a woman answering the question. So the gender relations or gender norms in a household were also important. The papers explore some of the alternative reasons for these patterns. A third question was, what are the obstacles to reducing household water insecurities in vulnerable communities, and how might they be addressed? So this is more of a policy and plan or program level question rather than something that individual households have to do. What we found, I guess the main overall finding is that obstacles to reducing water insecurities for people in vulnerable communities include issues of water access, water supply, and water quality. I'm going to talk about each of these in turn. Obstacles to water access relate to being in remote locations outside water service areas, so it can be a lot harder to get access to it. They're related to rights. If you don't have the documentation or not free to move, it can be more, you live in an informal settlement, the only thing you can do is drill water down or buy it in plastic bottles. You're not going to get a metered connection. The government won't allow you to, you don't have the right documents. And costs. In the case of Cambodia, Myanmar, and Thailand, drinking up to about 20 to 30% of households experienced high prices for drinking water, getting more expensive at some time during the COVID-19, but it was very rare in Vietnam and Laos. So there are some important country divisions. Of course, most countries reduced the fees for connections, but most vulnerable people didn't have connections anyway. So they're helping another group of less disadvantaged group. Problems of supply were compounded by COVID-19 too. In Vietnam, we will hear something about the dry season shortages, etc. But I'll take the example from Myanmar here. Under normal conditions in this vulnerable community, water was provided house by house. But during the outbreak, they could only fill a concrete tank in the middle of the village because they didn't want to cause disease transmission. So some people, water access got more difficult and actually more at risk because everyone converges on the same place to get water. Water quality issues were quite important, but not so well understood. As a result, the perceptions of risk differed between officials and vulnerable communities. Basically, there's not much data about whether the people are worried that the water is not very good, or people think it's okay, but it's actually not good. So the water quality issue is one where we needed more information that we could get just by interviewing people. We needed measurements. There's one interesting thing that popped up both among upland and lowland communities is that people recognize the importance of watersheds. So to end, our study had a number of lessons and recommendations, and I won't read them out here, but we'll hear about some of these things from our panelists. Yeah. This is my last slide. Thank you. Well, that's
Thank
me.
you, Doctor. Thank you, Dr. Lebel. That was perfectly on time. And thank you for those key findings that you looked at. And I'll now invite Madam Hapnavi to share the findings and specific experiences from Cambodia, where she led the research work.
Do you want me to stop sharing my screen or should I leave it on?
You could leave them on.
Okay.
That's fine as well. Over to you, Madam Hapnavi.
Yes. Oh,
I stopped sharing, so go ahead, please.
yes. Good morning, ladies and gentlemen. I think I didn't prepare PowerPoint presentation or something. I just talk. Okay. Yes. During the, I just would like to share the how what were the main obstacles that the research team faced during the research implementation and also during the COVID outbreak. Yes, at that time, the main obstacle during the implementation research, we have some obstacle like during that time we have restriction on traveling to the study area and also have lockdown some area in the study area and especially at urban location in Siem Reap province. And we also, the difficulty also to find the people or to meet the people for interviewing and conduct a focus group discussion because the local situation, they also announced that they have lockdown or because of the COVID outbreak. And for the research team, we also have high risk, high risk during that time. So we need a strong research team willing to do as well if we don't have encouragement or yeah, so we cannot go or cannot do. So that is we need to have strong encouragement from the of the team member. And also for the research team, we need to have to prepare the facility for protection from COVID-19. Like we need to wear masks during interviews, and we need alcohol. Yes, and we all know about that, alcohol to clean your hands frequently, and also sanitizer, and keep distance from the people and interviews during interviewing as well. However, even we face with some obstacles or some problem during conducting research, but we try our and then we reach our goal, and then of course it was not impact on the quality of the data, not at all. Yes. And we have some research finding. This because of the short time or just 5 minutes, I don't know how to. I just talk what is the focus and what is the obstacle, and what based on the observation and finding. I just want to show the group of people had access to clean the water for drinking or hygiene impacted to most in the study area in Siem Reap, including urban, upland, and lowland area, like slum dweller group who have landless or homeless in the study area. And in the urban area, like red zone, during that time they classify by like red zone, yellow zone, and orange zone, something like that. So that is. And the second, also the second group is a garment factory worker in the urban area. Those people, including construction worker, daily worker, including in the urban, also in the lowland area or upland area. Those including construction worker, agricultural worker, men, women, and children. And the fourth one is related to the local people who live in the upland and remote area, especially during the dry season. So they face with the lack of water access, in the local area, lack of hygiene in their living place, and high density of people living in their house because of the COVID outbreak situation. So people come back home. They need to come back home and live together. And also lack of water supply.
Madam Hapnavi, yeah, I mean, we are running short on time. So I get the point that you had several different community groups that you were looking at as part of the research work. And there were differences in terms of the locations and how that impacted access to water resources as well, right?
Yes.
Yes, thank you so much, Madam Hapnavi. Now I'll welcome Dr. Fumisai Siharat from Laos to share his experiences of what were the key findings which were specific to in the context of Laos in this research. Thank you.
Yes, thank you. Good morning, everyone. I just want to share what I have learned and also some experience during the COVID-19 outbreak, especially for the Laos. Actually, during the COVID-19 outbreak in Laos, also we try to find out some interesting in terms of the can people have the good practice in terms of the water insecurity or hygiene or water supply. So for our data collection, that we have some limitation of the data collection, like during our field work, during our conducted the information or data, we have some limitation for internet connection, because we did in one area is near upland. Upland is nearby the mountain, so it's quite difficult for us. So we try to interview in order to get the exact information. That is the first thing. The second thing, in terms of the local language, sometimes it's quite difficult. We need local people to do some translation for us. That is the obstacle for us. And some result that it would be interesting for me for the Pu Khao Kwai village is very limited water, like during the dry season. The local people they encounter with the water. This is very important. And also in the Phonga village, they also encounter with the water supply, because as I noticed and discussed with the head of the village there, he said that during dry season it's quite very difficult for the water supply, but they try to find out how to get the water. They just use the groundwater, or they just want to have another resources of the water to support them. So in terms of the drinking water, of course, drinking water factory, they also deliver the water. That is not big issue, but they are facing with the water for cooking, to take a bath or washing. So that is my experience when I conducted the data. So another thing that I want to add here, like if we have some financial budget to construct or to prepare or to support the water for them, it will be nice. This is for the Pu Khao Kwai village, because they are lack of water. This is for sure very important for them. Yes, that's all for me. Yeah, thank you.
Thank you, Dr. Fumisai. That was helpful. So basically what you have also highlighted is the need for decentralized water systems to ensure that there's access to water. Thank you for that.
Yep. Thank you.
So now I'll welcome Dr. Nilar Ong from Myanmar. She will talk about the issues and challenges that they faced in doing this research in Myanmar. Over to you.
Good morning, everybody. I'm Professor Nilar from Myanmar. I would like to share my experience about the voice projects. One of the obstacles we are facing in our project time is, as you all know, at the time we faced the political unstable situation in Myanmar. That's why, when we conduct the online surveys, at the time we have inconvenience because of our internet is very limited in everywhere. Then also That's why we need to print it out, all of questionnaires, about 300 for the selected area like mountain area, delta area, and also informal settlements areas. And then we print it out, and we have to go there, and also we ask directly to the peoples with the help of general administrative officer and also researcher, and also or some boundary partners with help us. At the time, we because of the political instability, we we have a very tough work to accomplish, to finish our surveys, about 300 questionnaires from 3 different areas. But with the help of the researcher and also boundary partners and also some kind general administrative officer, we accomplished, we finished very successfully. On the other hand, because of by doing so with in person, making the interview about the questionnaires, we knew about the real situations of the different people, different areas. We knew that one of the advantages for that. On the other hand, we face the obstacle. On the other hand, we have opportunities because we knew about the real situations of the people who are suffering within the COVID-19 area, COVID-19 situation and pandemic. And also I would like to add my experience about the results, key findings from 3 different areas. We already selected mountain areas, especially from the ethnic minority, and delta area from and delta area. It's very very favorable for agriculture and fishery, and also one of the informal settlements is very close to Yangon city. And for those 3 areas, 2 areas from this mountain area is already scarcity, or they are facing most of the ethnic minorities. They already face about the water insecurity in quantity of water. They have to rely on some spring water, and also some spring waters, and also the very remote area from their residents. So in the summertime, they are facing the water insecurity for both drinking and washing their hands. And also another area is the informal settlements area, and very close with Yangon city. But because of they are the migrant workers, most of the family members, they have to they couldn't afford the drinking water for their to buy the drinking water for their drinking water. That's why, because of the poverty, because of the migrants water, they cannot have the support from the governments. That's why the 2 area is already both quantity of water is already already facing. That's why in the COVID pandemic years, they are very suffer about the water insecurity, about quantity. And the one of the area, delta area is abundant of the water, but the quality of water is not insecure. But most of the people from the delta area, they didn't know about the quality of water is not relevant for their health. They have to use the spring water and also river water for their domestic use of water, and some cooking and drinking, even drinking water for that. That's why overall assessments on the quantity and quality of water is very not optimal, not relevant for their health in that situation. Another key finding is policy deviations in implementation, because we are in Myanmar system where policy policy hierarchy is we have 5 levels from national level to ward level. That's why upon the knowledge and skill and attitudes of the implementers, the policy deviated is we found in every mountain deltas and informal settlements area, we found that the policy deviation because from national to ward level, we have a 5 level. That's why they cannot, they cannot really implement it. What government want to make, want to do, want to establish, want to give them. And also, then another finding is the knowledge of the hygienics. Both poor and rich people, both educated and non-educated, uneducated people, they have very limited knowledge about the hygienics on the prevention for the COVID-19, systematic washing of their hands, and also masks, wearing the masks. And also because upon these 3 kind of the findings, the very vulnerable group, we found that especially among both mountain area, delta area, and also informal settlements area. The overall assessments on the experience on our result is we need to more give knowledge about the policy policy feedbacking about policy implementation, and also what the knowledge on hygienics, and also especially for the aging people, children, most children and big family from informal settlements, mountain area, and delta area. Thank you very much.
Thank you, Dr. Mila. And thank you for sharing those findings very specific to each of the areas that you looked at. Over to you now, Madam Chow Thi Minh Long from Vietnam, to share your specific findings from the Vietnam context.
Yes, good morning to you all. So I can know that in Vietnam, in the study area here in Đắk Lắk province, and we have 2 seasons in a year, 6 months in dry season and 6 months in rainy season. So during dry season, in general, in Đắk Lắk province, they also have the salted water during dry season. And for the study area, we select on the community in the remote area where the many are the ethnic people living. So they don't have opportunity to access, they not yet access to tap water, but they use the dust well. And with the shallow dust well, this will impact more to the people in the study area, because during dry season it will be such water, and sometimes the quality of water there is not good because of very shallow dust well. And we also find out that another very interesting finding here is that women are more impacted than the men, because for the ethnic people here, women mainly take responsibility to carry out water from their neighbor, because sometimes in the dry season, water in for their household consumption is not enough, and they have to carry out from their neighbor, or sometimes in one commune, people also have to carry out the water from river for household consumption. So it like a bit more burden into women. And I think that from observation and also from the research finding, there are a lot of water for hygiene. This impact not only for COVID, but also other diseases such as hand, foot and mouth disease, because all will be very related to the hygiene. So in the time that we carry out the survey, is like 2020. The outbreak of COVID-19 is concerned with the period with water shortage in the study area. So this will put more challenge to those who cannot access to tap water because they have to limited access hazard for hygiene, washing hands, and greenhouse, etc. So in theory, that hand washing is more closely related to spread of virus COVID-19. However, washing hand here we found that in somehow in more related to the people habit. Therefore, I think that it is very necessary to increase both water security and washing habits for the community, for the people in the community, especially for the people in the remote area, for the ethnic people. In the remote area where people do not have access to tap water. So the investment in drilling groundwater well or rainwater harvesting structure is very, very necessary. We need to provide to them. And from the observation and from the survey, we also talk with the people in charge of water management, and they said that in the remote area, like the government also have the policy about the give some investment to the community to build the drill well water to get deeper well to get more water for the community. So I think that if we have some kind of investment, maybe should pay attention to the village in the remote area, can help them to have like the deeper well with like a drill well to get more water for their household consumption. Yeah, thank you. And if have time, I just give say 1 minute about the article. And as you know that the study area in Vietnam, in Đắk Lắk province, we select on the community in the remote area with many ethnic people. So while working with them, we have a barrier like language, but we already solve it by can select some village headmen or some people can help us to translate. And also during the COVID-19 is we at that time we not yet vaccination, so we have to very carefully not only prepare our project team, but also prepare for the respondent. We provide them mask and gel alcohol and keep social distance, etc. So I think that all the data already collected, and we already have many interactive observation. Yeah, thank you.
Thank you, Ms. Long. And that was very helpful to, I mean, overall, there is a sense that yes, the problems were exacerbated because of COVID, but of course, there is a need to focus on providing access to water that might not just be about managing water, but also managing supplies and demands of that on that water. So I think there are lots of interesting conclusions that are being drawn from this study. Going forward, I'll now pass it on to Boripat, who will moderate the next session. Thank you, everyone.
Thank you, Shastima. So in this session, we will be hearing from our boundary partners who are individuals or organizations in the study locations that the project engaged with. Today, they will share a little bit about the water access situation for vulnerable communities in their location during the COVID pandemic. So the first speaker I would like to welcome is Mr. Mulu Songponsak from the Pakakayo Association for Sustainable Development in Thailand. Please go ahead, Mr. Mulu. ฮัลโหลพี่มูรูอยู่ไหมครับผม maybe he will join later. So in that case, I might go to a second speaker, Mr. Nupurk Wilabut. He's former Deputy Director General of the Department of Water Supply in Laos. Please go ahead, Mr. Wilabut.
Thank you very much. So, good morning, everyone. My name is Nupurk Wilabut, as he mentioned, from Laos. So I retired from the government for more than 3 years. So I'm talking today as a Lao citizen, not representing any government organizations. Yeah. So I will talk what I have seen, I have heard, I have read from newspaper, from television, and from the public or social media. So whatever we do here in Laos, we just follow the policy, the strategy of the government, of course, in line with the SDGs. When talking about WASH, of course, SDG 6 is very important that every country has to follow. So I will talk two parts, both without COVID-19 and with COVID-19 activities, because this is very important. So the country has approved a national WASH policy, a rural WASH strategy, and an urban water supply and sanitation strategy. One of the most important of the WASH policy statement is to promote and protect the right of all people living in Laos PDR to access safe and sufficient water services and to safe sanitation and hygiene facilities. You see that it doesn't matter that is COVID or not. So we do this. WASH sector in Laos have been and remains highly dependent on external financial sources for investment. It's very important because we are poor. Yeah, so we depend on this. Moreover, Laos PDR, like many other countries across the world, is going through a challenging time, responding to the health and cross-sectoral socio-economic issues that the COVID-19 pandemic is presented. We consider as entry point to reduce COVID-19 vulnerabilities and other hazards. So we have something more than the normal time. The Lao government has provided WASH infrastructure, equipment, and services to quarantine centers and isolation facilities to help ensuring safer, healthier, and more comfortable stay for many Lao migrant workers returning home. Many workers from Thailand, from neighboring countries coming to our country, come back home, and they have to stay in the provisional or temporary quarantine site. And the Lao government has implemented the project for access to water to fight against COVID-19, aiming at provision of new sustainable access to clean water by supporting the communities to build water supply systems and connect them directly to the household. This is because the new access to clean water means better way to protect against communicable diseases, including COVID-19. And in the urban area, recently, the government of Japan pledged a fund to the United Nations Population Fund to implement a project for safer cities. This is the intervention against COVID-19, focusing on WASH and protection for communities at risk. And the last point for today, what I know is that as part of the new normal, our government has issued a national directive on hand washing, is hygiene. This is being implemented by the introduction of water and sanitation for hand facility improvement tools, or we call WashFit, programming in hand care facilities with support of the WHO or the World Health Organization. That's all. Thank you for today. It's very short time. In fact, I have anything to say. Yes, thank you very much.
Thank you very much, Mr. Willerwood, for sharing. I would like to welcome back Mr. Mulu Songponsak from the Pakakayor the Association for Sustainable Development based in Thailand. P. Mulu, please go ahead.
Okay, good morning, everyone.
Good morning,ครับ
My
พี่มุลุ
name ได้ยินไหม
ได้ยินครับผม
Now I work for Pakakayor Association for Sustainable Development. It's good to hear. It's good to learn from your experience about the water issue during the COVID pandemics. So for my experience in the Mekong district in Chiang Mai province. So when we talk about water problem and water shortage in our areas, community areas. So normally we face the water shortage during the dry season from March to May. That's every year. But one thing that we have a crisis more during the COVID-19 pandemics. I can say that this is a very good experience. I can call COVID-19 as the super teacher, can make the people awake on water use and water use, or both for drinking and hygiene or domestic use. So I found that so in the past, when we talk about water shortage, so everyone complained about water. They don't have water, so they don't have enough water during dry season. But as the COVID-19 pandemics, so we can see that okay, COVID-19, okay, it's happened in 2018. But in Thailand, we received, I use the word, received the COVID around March 2020. So at 2020, the people don't mind, because especially the people in the rural area, they don't care, they don't mind. They're afraid, they're scared. But as you know, the impact, because of the pandemic, is not in the countryside, just in the city. So we can see that, and then after 2021 until now, COVID-19 already spread to everywhere. So water is a big issue. Okay, some community, if they have enough water, they don't facing with the water shortage, so they can take care of themselves. They can use for water for everything in their life. But the case of me at more key communities, this communities that they always facing with the water shortage. So when we talk about water, so the people are awake to how to store it, how to keep the water from the they don't have enough stream, water, fresh water or groundwater on the stream. But the people are thinking about how to collect the water from their roof, to make they collect in the pond, or to collect in the water tank. So the people are awake. This is for us. Another, the people also asking for how to build more the water source, especially the upper water, upstream. Maybe they can use some traditional knowledge or local wisdom, find some kind of tree or plant to make a moisture. Like okay, in our livelihood, we talk about wild banana and two or three things in Karen language we call water tree, seti in Karen language, and then another one is sure. So three kind of these can make more water, can make more moistures. So these are part of this is the community levels. But as the family levels, the people try to making water pond. Water storage from the root. I'm not sure how long I can say. Already finished or my time?
Maybe just a little bit more is okay, Mr. Mulu.
Okay. So during the COVID pandemic, no, for the beginning, people from the local government, so the people have to stay home. Some community, they got COVID, the whole community. The people anyone don't allow the people get out from go outside. So for water drinking, the people can save them. I mean, from 2020 to 2001. So this everyone have to take care of the pension, no? But after it from 2002, so the pandemic is a very already spread. So everyone have to use the water from the communities. For the I found that for the adults, people who have age around over that 40, they will drink water by the boil water, because they think about how to maybe about the disease and heal protection and save water for their life. But for the young generation, they don't like the boiled water because they say that they already cooked. The taste not good, but they try to use
water filtration. Water filter.
Yeah. So the new generation, they try to use water from the how to make it clean, both in the community levels. At the family, they also buy some of again sorry.
More water filters.
Yeah. So this one. I think now the people awake for find a new resource, awake for storage the waters, awake to, I think many things. This is just for my experience. When you talk about without any situation that the people are facing, it's not a message for the people. But because of this is pandemic, this can help. So for myself, I want to say thank you COVID-19 too. No? Okay, one thing I blame them is a very scary, but another thing, most people have learned a lot how to adapt themselves, how to approve the livelihood, how to their family, how to save the resources too. So that's it. Thank you.
Yep. Thank you very much, Mr. Mulu. The third speaker I'd like to welcome is Mr. Sangswat Sitlakon from the Department of Water Supply in Laos. Please go ahead, sir.
Can you hear my sound?
Yes, I can hear you, Kap.
Good morning, everyone. I'm Mr. Sangswat from Department of Water Supply. Distinguished guests, ladies and gentlemen. Firstly, I would like to introduce my name. My name is Sangswat Sitlakon. Formerly, I am Director of Sanitation. And I get to know this project from Mr. Pumistai from National University of Laos. I also join the questionnaire, answer questionnaire for him. Under the topics like a voice from listening to the machine lesson from COVID-19 crisis, improve access to clean water for drinking and hygiene in the Mekong Region. Under our department, firstly, I do agree with my former boss, Mr. Nupuk Gerabut. He's Deputy Director General of AWS. We also worked closely in terms of the water supply and sanitation. As you know, the currently of the situation during the COVID-19 in Laos with concern DWS mandate, we have the many supporting projects to support us for the water supply in the urban area and also the outside area. In terms of obstacle for the COVID-19, we have the project support for equipment, for the equipment and some material, and also we have the project campaign awareness for the protection. We have the activity for the community and social. For the organization, we also under this project for support from Carbon Clinical Institute like TGI, JECA, COICA, and other development. We support the equipment for the protection for COVID-19. For instance, we support for the equipment for the washing hand in the public area and organization. For the local community, we also the campaign awareness for the community in the project area for water supply and sanitation project outside Vientiane in the Provincial city. We also make the brochure for the local community, for the basic how to protect COVID-19 pandemics. We promote a lot under the projects. From now, we still have the activity to support community, a social in the project area, and also we have the last 2 weeks. I also joined the JECA project and the capacity development in Singapore province in the northern part of Laos or northern part of Vientiane. We support the campaign awareness and community and school washing activity for the children or for the student, like a level primary school. Yeah, it is from the assessment we got the information and feedback a lot, and now we have still support project from the public sector, development and partner under water supply and sanitation project. That is not my experience, is our department that we try to support under the COVID-19 pandemics, just begin and until now. Yeah. This is my idea and opinion that we gain from this project. Yeah. Thank you very much for your attention.
Thank you very much, Mr. Sangsawat. The last speaker I would like to welcome is Mr. Hu Niadam from 333 Hospital in Dak Lak Province, Vietnam, who will be sharing in Vietnamese, and Ms. Long will help to translate into English. Please go ahead, sir.
Hello.
Yes.
Rồi. Xin chào tất cả mọi người. Tôi tên là Ihu Niadam, là người dân tộc Ế Đê, sống tại Buôn Tân Sinh, xã Ái Đa, huyện Ea Ca, tỉnh Đắk Lắk. Trong buôn tôi có 1.972 nhân khẩu và 554 hộ, đa số là người đồng bào dân tộc thiểu số sinh sống. Và địa phương ở đây thì thường xuyên thiếu nước sinh hoạt vào mùa khô, nhất là vào tháng 6, tháng 7, tháng 8 ở trong năm. Hiện tại thì trong thôn thì chưa có cái nước máy, tức là nước máy sử dụng. Đa số họ sử dụng nước giếng. Vì không có đủ điều kiện cho nên là 4-5 hộ có thể sử dụng một cái giếng, cho nên cái điều kiện mà nước sạch thì rất là hiếm hoi.
Yeah, do you want I translate now or when you finish? Okay,
Ms.
maybe.
Long,
Yeah.
can maybe summarize translation at the when it's finished. Yep.
Yeah, okay. His name. Okay. My name is Ihu Nikelam, a pupil living in Thompson Village, Eda Commune, Eka District, Daklak Province. And the village has like 1,090, more than 1,090 people with more than 500 households, and most of them are ethnic people. And this area often lack of water during dry season, and the local people mainly use duck well, and around 4 to 5 households using one duck well together, and not yet access to tap water. So in dry season, there often lack of water for daily consumption. It's like from in July, 7 August. Yeah. Anh Hữu tiếp tục.
Trong cái mùa khô thì nước hay bị nhiễm phèn, nhưng mà họ vẫn sử dụng. Ngoài ra thì có một số hộ thì mua được cái nước bình để uống, còn một số hộ thì không đủ điều kiện để mua nước bình dùng hàng ngày.
Yeah, during dry season, the quality of water is not good, but the people have to still use that water for household consumption and drinking. And some household have ability to buy hot water for drinking. Yeah, continue.
Rồi, rất mong chương trình giúp đỡ, cuối cùng thì mong chương trình và giúp đỡ hỗ trợ cho người dân trong buôn được tiếp cận với cái nguồn nước sạch trong sinh hoạt và ăn uống. Anh chân thành cảm ơn.
Yeah, some households have possible to buy hot water for drinking, but another may not have ability to buy hot water for drinking. So he said that would like to have some support from program to help the people in his community to access to clean water for household consumption. Yeah, thank you.
Yep. Thank you very much, Mr. Ihu Niadam and Ms. Long, for helping to translate. I would like to thank all boundary partners for joining us today and sharing your experiences. And I would now like to hand over back to Shashmita for our next session. Thank you very much.
Thank you, everybody. Thank you, Varipat, for taking on this session. Now I'll invite our project mentor and gender advisor to discuss and share some of their thoughts. So I'll first invite Dr. Chu Thai Huan. I'm sure it's very late at your end, Dr. Chu. Sorry for that.
Okay, no problem, still early.
Thank you so much.
Okay, good morning, everybody. As a mentor, I have 3 points to mention now. First is that I see that what are the strengths of this project. From this point, I have 3 ideas. The first is that the topic of this study is a burning issue. It is a COVID-19 in 2020 and 2021, when the pandemic is become serious in the Mekong country. Therefore, SUMERNET put this study under the SUMERNET Emergent and Rapid Response Research Grant. So it is a really burning topic at that moment. But the second idea is the methodology using in this study is a very appropriate to the subject with data collection, survey activity, including face-to-face and online interview, and you hear a lot of difficulty during that period by the partner in different countries. And also, I must say that interesting data analysis method, like including the odds ratio method in the analysis, and that reflected through the 2 papers published in the international journal with quite a good impact factor over 3. That reflects the good scientific study of the project also. As a third idea about the strength of this project is a regional scope with over 1,500 interviews in 5 countries. And that fit very well to the SUMERNET regional point of view. And this during the COVID pandemic situation with different government strategy and people strategy reaction to COVID, including urban, peri-urban, upland, and lowland rural area of marginal community. And I think that is quite a strong study project. Now, what finding of the project that I think most significant? I think that in terms of water insecurity, quite interesting to see that we see that the control of the government, like a lockdown or restricted movement or limiting business activity, have a few impact on household water insecurity. But the hygiene practice like a washing hand, wearing mask or washing mask, face mask have a stronger interaction with water insecurity in the household because of the lack of clean water. So in the Mekong, we see that despite the investment to supply water, but only quantity, but water quality still a big issue and a big problem to see the rural, in particular remote area. So we see that this is quite a, we say that even Mekong country is a relevant and quite a good abundance of water source, but water quality is we must say that's still a big issue and pay attention. Now, the third question we may consider is that what next step? I see that now even COVID pandemic is less serious, but at the present, most countries and even WHO also consider 3 scenarios. The most expected and possible scenario is the continuation of COVID, but not so serious as in last 2 years due to population immunity and vaccination. But the 2 extreme scenarios as one. The good scenario is a new COVID variant, but not serious, and we don't need more further vaccination. And the best scenario is a new dangerous COVID variant happen and require more control, and new vaccination will be required. So my project shows that during the COVID pandemic, these vulnerable community require sufficient clean water for drinking and hygiene. I propose that may we return to those respondents to ask them what happened now after the COVID become less serious. Do they continue with the method or with control or with face mask or with cleaning hand either during the COVID or not? Even now, which they consider like a return to normal life. And what they plan and what they propose to prepare under this 3 scenario. We may not have to return to 1,500 respondents, but we may select those that are relevant respondents during our survey And chat maybe no need face-to-face, but chat to online, ask them respondent. And that will be interesting studies that we can do with not much cost to SUMERNET. But the response could be very interesting for our study. The second, last point, the second is about from management point of view, how we can produce enough clean water for this marginal community under this scenario. Keep in mind that it will take many years to produce infrastructure, but also important is that change the method and the thinking of people about using clean water, in particular culture, gender arrangement, etc. So we may need some study to consider this point. Thank you. That is my last part.
Thank you, Dr. Chu. That was really, really helpful. And in fact, you raised some very pertinent next steps that we need to probably think about as we go ahead into how do we see the changes, or what does this teach us to take forward in the post-pandemic world. Thank you so much. Now I'll invite Dr. Cynthia McDougall. She's a gender advisor, and she'll share some of her key thoughts on hearing on the project. Thank you, Cynthia.
Thank you so much. And I would just like to say first a congratulations to every presenter and every participant in the study and the members of the teams. It's absolutely extraordinary. What struck me was how nimble and yet how focused the study was, how collaborative, and as well how it brought in a focus on people who are most at risk. So first of all, I just wanted to say kudos to everyone. Very, very well done. I wanted to also share one more thing that struck me as such a positive, and then offer 3 suggestions for next steps as the project looks ahead to influence into a, we hope, post-COVID world. So the other very strong positive I wanted to flag was that while many projects, and especially during the COVID pandemic, missed or actually lost ground on including a gender lens, I was so excited to see hear a little bit today, and also see in the published paper that gender was included, at least in sex disaggregation, and that was combined with an assessment and comparative look at different risks, at high-risk groups, whether it's remote rural areas, low-income urban areas, ethnic minorities, and there was even mention of youth. So really, congratulations. And my first and very, very small suggestion for going forward is, while hanging on to that, maybe there's a next level to take that to in terms of sharpening between norms and gender division of labor. I thought there was a nice example from Vietnam that focused on gender division of labor, and that will certainly continue to be important. And I wasn't clear from what we heard and what I've read, was that gender and that what we call intersectional gender lens, that combination of social and gender, was that just in effects and adoption, the analysis of those, or was it also applied in understanding factors and drivers? And so I'd really encourage that to go right to those root causes as well. I'll offer 2 more suggestions, and the first is methodological. And this actually links a little bit to what we just heard from Dr. Huang about going back. My first thought was, if there is a next stage, I think it could be very powerful to complement the quantitative data with qualitative data, not just because it nuances and triangulates, but because it has explanatory power that surveys just don't. So consider that. It's so useful for a complex system. And touching on that as part of this methodological suggestion, could a next stage look at multi-scales more explicitly? What are the drivers at multiple scales and how do they connect up? And I think a really exciting next step could also be, connecting also to what Dr. Huang said, what about now? Try to do some kind of impact assessment that builds on what's been done and really pulls out what are the positive case studies and what are the less successful case studies, and hang on to that intersectional gender lens as you do that. So it's not just what was delivered, but who benefited. And that brings me to my very last point, which is about the framing. This, of course, was about access and quantity and quality. From a social lens or a gender lens, we often think about, well, let's not just talk access or reach, Let's also talk benefit, and this started to touch on that. But then the next part of that chain or framework is empowerment, which is about agency. So who is making the decisions about the policies and programs? And we talked about decentralizing water. How can that mean not just something is delivered and then communities control it, but what about voice in the entire process? Voice in the project and gathering data, returning the data and allowing people to use will be important, but also I'd encourage the project in the next stage to look at that reach, benefit, empower. And my very last point on that is the fourth part of that framework is about transform. And so connecting to an understanding of underlying hidden barriers, whether they're formal like policies or informal like norms, what can be transformed so that we prevent impacts being so severe or exacerbating inequalities in future shocks. And so that we take COVID as an opportunity to not just survive, but to in fact rethink and rebuild our systems, eliminating those underlying inequalities from the start. Thank you. I'll hand back to you.
Thank you, Cynthia. That was very, very helpful. And those are some of the aspects I think going forward, all of us will be looking at as well, because we are also strengthening how we want to include some of the underlying factors that are impacting access to water and therefore impacting insecurities to water in the Mekong region. And that's a larger question that is being handled within the SUMERNET program itself. So going forward, and if there are any questions that anybody has, you can raise your hands. I can see a couple of questions on the chat box and I'll take them. There's a comment from Prasad Makor, who mentions about the importance of risk communication during COVID times and what happened in Thailand in that context. He or she is interested to understand who are the key people who play a role when it comes to addressing the issues or problems of the hill tribes in Thailand, and were there any specific findings from the study that anybody could refer to?
Perhaps I can answer that one. But Mulu, feel free to add if you would like to. The Osomor group was very important in the construction workers camps and in the informal settlements of Chiang Mai. So 2 of our 3 sites, Osomor, these are the health volunteers, were important. They weren't, we looked at their quality of their work as well, and they were not always very high standard, but they clearly have a tremendous reach. So training, if you're going to work with them, you need to really do some training and some quality control work if you're going to use it for, because, well, it's just the way people are. They take shortcuts, etc. So we have mixed experience. We worked with the Osomor in these places, very good ones in one place, and we had to throw away data and retrain in another place. In the upland areas, NGOs like the one that Mulo runs for the Karen people are really important. It's not only about the health system and the local government, but the NGO civil society organizations are also very important in the uplands. And his own organization is one of the important ones. And what they focus, and we heard from our colleagues in Laos too, they pay attention to development. And we keep, whenever we meet, we keep wondering how can we put research and development together more closely so that we end up building water supply or help develop the proposal for the development work. The boundaries between development and research, it's always a tension for us. We've done the research and we're kind of where we're strong at. We have to work with partners if we're going to do development work. We can't do the development work ourselves.
Thank you, Dr. Level, for that answer. There's Chinese who has asked a couple of questions. It includes, do you see the research results that surprise you? And what do you think should be the focus in future studies or in terms of policy engagement if we have another opportunity?
If anybody in the team would like to respond, please do. If not, I will. But if anybody else first. Okay, I'll start, and then if somebody wants to add after me, please do.
Okay.
From side, go ahead. Yeah, go ahead.
Yeah, yeah, I'm sorry. I just want to share some experience, maybe is related or not related to the question of Dr. Shayanis. So actually for me, the result is quite surprised me, especially in the Pukakwai village. In the beginning, we thought that they have enough water in terms of the water supply. Then we collect all data and then we try to see the result, the finding. So it shows that is not enough, and then is insufficient water. So in this case, if we need to continue in order to conduct the research in the future in terms of how can we use the natural, the nature base to adapt the climate in terms of the water is not enough. This is just my idea. Yes, in the future, if we can do, because at that area they also have the stream, they have water, so we can use that one in terms of nature base to support them. Just my idea. Yes, thank you.
Thank you, Dr. Pumisai.
Can I join for 1 minute?
Yes, you could.
Can I share one picture? Can see my screen or not? Yes, this is my. You can hear me or not?
Yes, we
Okay.
can hear you.
Because of the water adaptation or water adjustment, after we work on water shortage around 20 years, so I found that in the rainy season we have over number of the water, no, but in this dry season very dry. Well, we try to work with the community that let's see, this is my pond, no? I'll try to make it in my garden. This I call it as outdoor water storage. I don't take the water from outer source. I just open from the rainfall. So let's say that it's full every year. It's full around July. This is the picture I showed. This picture the July 2020. So we can see another picture.
Thank you for sharing this.
Yeah, this is for the outdoor. In April, so I have a water stock. If we calculate from the size of the water, around 9 cube. I'm not sure how many. If I cannot calculate it, but the engineer told me that I have water stock the water around 9 cube. So I can use it for the small plant. So I can use it for other things. So even the even the water for the roof. So we can, I think, if the people try to think about how to store the waters by outdoor or indoor by the on the roof, how to continue, how to let the people awake on water storage. So different places may be different idea, especially the I think the water already now is enough for everyone. But if the people cannot save and cannot store it, I think that's problem in the future. So thank you.
Yeah, thank you so much for making that point. And it is as much about infrastructure as it is about processes. And it's about the powers of decision making. Who is making this decision make? And who is accessing this water? So those will be also key questions as we look at how we solve the insecurity issue. So the other question that's there on the chat box is by Andrew Noble. And the question is, if you look at the spatial distribution of COVID, both from numbers infected and those that succumbed to COVID in the region, what was the distribution between urban and rural cohorts of the population? I'm not sure if anybody in the panel, because this was not really the focus of the study as such. The study was looking more from the perspective of access to water and how that impacted because of the pandemic. But if there's anybody who would want to respond to this, you're welcome to.
Hello. Hello, Shumita.
Yeah.
I just not respond to that question, but I just would like to add some information on gender issues.
It's coming to you, sir, actually.
Cynthia, and also seeing that participants to the seminar today, there are a balance of women and men. Yeah. So I have an idea to contribute something what we have done regarding gender issues during COVID-19 in Laos. So in the quarantine and isolation centers, so we have constructed proper gender separated bathroom. Yeah. So we don't leave the women behind. And in addition, also at the quarantine center, the women and girls at quarantine and treatment facilities of FIEM Hospital have received kits to support their sexual and reproductive health and right during COVID-19. The kits consisting of toothbrush, toothpaste, soap, shampoo, reusable masks, sanitary pads, and buckets. Yeah. Just an example. There are many others we have supporting and help the women and girls. Thank you.
Thank you, sir, for that intervention from your end. Are there any other questions? Does anybody want to raise a hand and ask a question? If not, I'll request Agus to take forth the next round, where he's going to share, I think, an online survey for evaluating the seminar. Thank you, Agus. Over to you.
One question before you go to Agus. Can I make a response? This is Louis here. Can I make a response, or will I get a chance later?
Yeah.
May I make a response to the suggestions from the gender and mentor?
You can respond. Yes, please go ahead.
And then I finished. So I'd like to thank very much to Cynthia and Chutai Huan for the suggestions on future projects. I think this has been the most surprising result has been the importance of water quality, to answer Shanice's question. But the most important feedback we've got is about what should we follow up with. And there's clearly some work for development work in the places we worked in. But from the point of view of more of future policy, etc., I think the idea of following up the cohort of people we interviewed, because we know things before they had none, there was no COVID even in their village, and then at the end there was a lot of COVID in the village. We can ask questions about whether people get tired and change behavior, or do they change behavior when they have infections within their community? It's not just lockdowns, it's infections next door. So I think the idea of a follow-up study is a really strong, powerful one, and I have to talk with my team to see if it's possible, whether the number of times that we kept the record of the mobile phone number of the informants, whether the qualitative or quantitative follow-up study is feasible or not. We didn't really plan it as a cohort study, but it would be a terrific opportunity if we could do it for Voices too. So thank you very much to Juan, and in some way Cynthia as well, also for suggesting the next level of analysis, the next level of connection. So that's all I wanted to say, and I'm happy to move on to other things. Thank you, Shumita. Thank you for all the inputs from everyone.
Thank you, Dr. Level, for sharing those thoughts. So over to you, Agus.
Thank you very much. So the next session is actually going to capture your reflection about this event. In a post-event evaluation, we need your insight or inputs to how this event will be was organized, and this will be useful for our next public seminar. So if you can just fill in the survey link, follow the survey link I posted in the chat box, that would be very much useful. So this is very short survey, 2-3 minutes, and then you can give us your valuable inputs.
Thank you, Agus, for sharing that. So can people respond on the link and submit it?
I'm also sharing my screen. If any of you use mobile phone, you just can scan the QR code by pointing your camera, and then it will be brought into that survey link. Thanks. So thank you. I think that's it, Susmita. Thank you.
Yeah. Thank you. Thank you so much. Thank you, the panelists who shared all your time and all the findings that you've had. It was one of the most challenging times to have taken on this study, and very, very relevant in the context of what was happening. So thank you for the study and the findings that have come out and the sharing that happened today. Thank you to all the participants who have joined us on this public seminar. This was our first public seminar, and I hope we'll do better as we go forward. So please feel free to respond on the post-evaluation link so that we improve on what we do henceforth. And thanks Cynthia, thanks Dr. Hu, thanks all the boundary partners who were involved, and thanks Boripat and the team here at the SUMERNET Secretariat. Thank you for all your help and all the back-end work as well in making this seminar happen. Thank you, everybody.